Hey, welcome to iHeartRadio's CEO Unplugged. I'm Michael Riedel of 710 WOR, and today we will be speaking with Tom Wang and Dr. Jay Lee of ProCure. Tom, can you tell me a little bit about ProCure?
Sure. Hi, and thank you for having us on. My name is Tom Wang, CEO for the ProCure Proton Therapy Center, located in Somerset, New Jersey. Our facility is easily accessible in the tri-state area with a driving distance of about 30 miles from New York City. We have been around for over 8 years now, and happy to say that we made proton therapy available for over 5,000 patients. Included in that number is 755 pediatric patients that we have completed treatment thus far. Our youngest patient is 12 months old, where our oldest patient is 101 years old.
Wow.
Regardless of age, though, we provide definitely good stats there. But regardless of age, we do provide the highest level of clinical care and compassion for our patients. In addition, we've treated patients from over 20 countries. And for our local patients, they come from all over the place, including amazing institutions such as Memorial Sloan Kettering, Hackensack Meridian Health, Montefiore, Mount Sinai, Northwell, Central State, and NYU. We're extremely grateful to be able to offer this unique treatment capability, which Dr. Jay Lee will speak more about.
Yeah. Let me ask you, Dr. Jay, what is this treatment that you guys are so confident in? How can it help our listeners?
Oh, thanks. So proton therapy is really just another form of radiation. And we use radiation often to treat all types of different cancers, either in a curative sense or in a palliative sense to help with symptoms. The major difference between protons and conventional radiation is that proton therapy has no exit dose. So this is sort of a crude example, but if you think about a bullet, there's both an entrance dose as well as an exit dose. So the organs that are around where we treat, they're often exposed to much higher doses of radiation when we use conventional treatments as opposed to proton therapy. We're able to basically stop the proton beam at any specific depth in the body and thereby reduce the sort of collateral damage, the dose to the surrounding normal organs.
So let me ask you about that, Dr. Jay. Listen, I go back a way, and I've had some relatives of mine who've had cancer, and they get blasted with that kind of radiation, and it wreaks havoc on the rest of their body. You guys can control exactly where you're going to pinpoint where that radiation goes?
That's right. So proton therapy has a unique physical feature. It's called the Bragg peak. But without getting too technical about it, the way that it interacts with the tissues in the body is such that we're able to specify at any depth within the body where the majority of the dose deposition occurs. So we're able to target that dose much more conformally. So organs nearby, they're exposed to much lower doses.
So Tom, this is such a great treatment. How come more doctors aren't using it? Why are you guys kind of the pioneers on this front?
Well, from our side, it's a lot of this is education, and it's making sure that the doctors all understand the availability for this clinical treatment. And secondarily, it's a lot of education also on the patient side, making sure that we make it fully aware that patients know that this treatment exists. And a few years back, we've been around for over 8 years now, but when we first got started, there were about a dozen treatment facilities in the country. Right now, there's about 35 proton therapy centers that exist and are open for patient treatments. There's a lot of education needed, and we want to make sure that for all those that are eligible for proton therapy, that they do have access to it.
Dr. Jay, just want to ask you, you've dealt with a lot of cancer victims over the years. How do you explain to them what is going on in their bodies and how you can help them?
Yeah, my goal whenever I meet with patients is really to describe everything that they've been through so far in terms of their workup. And then when we talk about where things stand now, what we aim to do with radiation, we like to go over both what's anticipated in terms of the success, as well as any potential side effects that they might get from the treatments themselves. And oftentimes, this type of treatment, because we're able to spare the organs that are nearby, the long-term side effects tend to be much lower. So patients benefit in that way. The dose that's delivered to the tumor can often be to the high curative doses that we need, while sparing a lot of the organs that are nearby.
So, Tom and Jay, how did you guys come up with this idea? I mean, you're both in the medical field. Do you have people that you knew that you loved who had cancer, and you saw some terrible battles that they had?
Dr. Lee, please.
Yeah, so proton therapy has actually been around for many decades. It's just that the infrastructure and the equipment to generate the proton beam is just prohibitively expensive to have, these centers at every corner block. So it's been around for a while, but the availability is just starting to become more widespread. But still, 35 centers, if you think about it, on average, that's less than one center per state. So it's really not something that's widely available yet, but for certain patients, it has a tremendous amount of value.
So, Tom, I guess, Dr. Lee seems to be the expert on this, but you're the CEO of this company. What got you interested in this kind of science and research?
One side of it is just walking the clinic floors as well, on a personal front, walking through and just, seeing the technology, seeing the capabilities to be able to treat the pediatric patients, many patients with whether brain tumors, having, surgical resections prior to radiation. And it's a great feeling versus many of the other different industries. This is a great one that we're able to, make a real change in patients' lives. And it's very fulfilling as well, going home at night and, just knowing that, we've done a lot of great work for a lot of patients that can benefit from this technology.
Yeah, I think, Dr. Lee, we've come a long way since the days of getting the cancer diagnosis. And, frankly, I've had some relatives of mine who've died of cancer, and you thought it was a death sentence. And I think with your treatment, there's a lot of hope here.
Absolutely. Overall, the treatments for cancer, they're changing every day. There's basically three ways to think about cancer treatments, and radiation is certainly one big part of that. And proton therapy sort of represents kind of the latest technology to be able to offer patients.
So where can people go to learn more about ProCure and this new type of cancer treatment?
Sure. Anyone who wants to learn more about ProCure, they can go to our website, www.procure.com. That's PROCURE. They can also call us directly. Our number is 877-967-7628. We've also recently updated our website to include a 360-degree virtual tour of the facility. It includes all the treatment rooms, and sometimes that takes out the mystery and also some of the fear of what it would be like to come in for daily treatments. Additionally, we also have dietitians, we have social workers, we have a concierge team to assist our patients with whatever their needs may be, if it's financial assistance, to housing, to transportation needs, and also just guidance in terms of how to eat a healthy and balanced diet while they're undergoing their cancer treatment. So again, our website is procure.com, PROCURE, and our phone number is 877-967-7628.
Hey, Dr. Lee, I got to ask you, we've been living through COVID in this pandemic for the last, going on now 9-10 months. Any concerns that you have that people are letting things that they should have been looking at, should have been treated a while ago? Are they letting them kind of go right now?
So there is some evidence of that. And, the advice that I usually give to all my patients is everything is a benefit risk ratio balance, right? You have to weigh both the pros and cons. Obviously, COVID is a huge health issue right now, and we want to make safety our utmost concern. So we do have a lot of new protocols that are in place at the center to make treatments as safe as possible to minimize the risk of exposure. And what I also tell patients is we have telemedicine visits that are available. and talking to your physician about the appropriate timing of treatments. That can be all done virtually. And if it is necessary to treat the cancer despite the ongoing pandemic, we can do that safely.
All right. All right. So, Tom, tell me again, where can people go to learn more about ProCure?
Definitely. It's under website is www.procure.com, PROCURE, and our phone number is 877-967-7628.
And Dr. J, just before we leave, throughout my whole lifetime, people always think there will be one day a cure for cancer. Do you believe that's possible?
So I think, that's definitely what we would all hope for. Unfortunately, cancer just represents such a heterogeneous mix of different diseases. There's not going to be one thing that cures every type of cancer. So there's going to be a targeted approach, personalized to each individual. And it may take a combination of surgery, chemotherapy, immunotherapy, and radiation. But some of these combinations often do result in many cures for many patients.
Right. And I guess the important thing to know about ProCure is that it's different from what we know about cancer treatments in the past, that really sometimes the treatment is worse than the disease. And you guys are figuring out a way to make the treatment better than the disease.
Absolutely. So as oncologists, that's the last thing that we want to do, is to leave the patient worse off than they were to begin with. So any side effects that we can save, we can spare from patients, I think it's a very laudable goal.
Absolutely. Okay. All right. Nice talking to you guys. Thanks a lot. Go to ProCure to check out the kind of treatments that they have for this terrible disease called cancer. And good for you guys to figure out a way to make those treatments not as brutal, frankly, as they once were once upon a time.
Thanks, Mark.
Thank you so much.
Thanks, Tom. Thanks, Dr. J.
Appreciate it.
I'm Michael Riedel, and thanks for tuning in to CEO Unplugged.